These are some of the major developments we are tracking. Diagnosed cases of COVID-19 climb past 2.9 million here in this country, with deaths now above 130,000. At least 924,000 people are recovering. With me here, starting us off, is ABC Chief Medical Correspondent Dr. Jen Ashton. And Dr. Jen, we've been talking about cases rising in this country and hospitalizations going up, but a lot of people are wondering how to deal with those mild cases that the majority of people are suffering from.
And so many people are asking about this, Amy, because while the focus understandably is on hospitalizations and deaths, about 80% don't require hospitalization, and there hasn't really been a lot of attention paid to how to manage that at home. So for suspected or confirmed or asymptomatic cases, you obviously want to consider home isolation. You want to do that if possible with some communication with a healthcare professional, either one that you regularly have or someone you can call. You definitely want to closely monitor for signs or symptoms of deterioration. So that would be things like chest pain or difficulty breathing. And you do want to avoid lying flat on your back. We've heard a little bit about that in terms of hospitalized patients, but it bears repeating even if you're at home. And one thing that people don't necessarily think about is overhydration. You hear when you're sick, when you have a fever, hydrate, hydrate, hydrate. There is such a thing as too much, and that can impair pulmonary or respiratory function too.
All right, and what about people who are at home? There's obviously tremendous concern about household transmission.
Right, and we've talked about that. That is a significant risk. In some studies, it's been shown to be over 10%. So you really, if you have someone at home with a known or suspected or confirmed case, if possible, really that person should be using a separate bedroom, even if it means that the healthy person goes on the couch for a period of time. Clearly, you want to sanitize the bathroom, the kitchen, any communal areas as much as possible. Mask definitely goes on that sick person, and a good idea to keep it on others in the home as well. And, you know, ventilation, really important. So you want to open those windows and avoid using indoor fans, which can actually spread those viral particles or aerosols even more.
Oh, wow, that's good to know. And then a lot of people are wondering, at what point are you considered cleared or recovered?
Right. This is probably the #1 most common question I get all the time. And again, there has been kind of murky guidance on this. So according to the CDC, there are some numbers that people should know about. #1, 10 days after a positive test if someone has no symptoms, 10 full days, 10 days after symptoms started, and 3 full days without fever or symptoms, and that's without fever with any fever-suppressing medications like acetaminophen or ibuprofen. If someone has been tested and they're using what we call a test-based strategy, that's 2 negative RNA swabs at least 24 hours apart. We've talked about some problems with that because people can continue to test positive even though they're not contagious or infectious, but as of right now, that's still on the CDC site.
All right, Dr. Jen, thank you so much.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.